Allow me to introduce myself. My name is Viola Pierce. I have been a nurse for the last 24 years. I have been an ER nurse over the last 14 years. I currently serve in a 66-bed emergency department in Eastern North Carolina as a shift supervisor. We see about 70,000 visits a year. We see on average 200 visits a day. Just last week, we had 99 people check in between the hours of 7 a.m. and 12 p.m., an average of 25 per hour. We have a 6-bed locked behavioral health unit. On this day, we had 13 behavioral health patients that were boarding in our clinical decision unit. The clinical decision unit was a unit that was designed to decompress the emergency department, be staffed by inpatient nurses to hold the admitted patients until they could be transitioned to the inpatient units. However, we have an emergency nurse staffing the area. Emergency nurses are trained to care for the acute psychotic episodes that presents. They are typically not as keen in the arena of long-term psychiatric care. Emergency department overcrowding is an overwhelming problem that is present in many emergency rooms across the world. It has captured the attention of the World Health Organization. Shah et al. 2014 cites the issues of emergency department overcrowding as follows: inability to transfer patients to inpatient beds, unavailability of specialty services, slow throughput, and insufficient ER space. There is also growing visit volumes, financial pressures, operational inefficiencies, and hospital closures. This increases the morbidity and the mortality of each patient that walks through the emergency room doors. It is the front door of access to care for many people, with an increased number of those patients having true emergencies. The issue is a large one that needs to have involvement from each entity in the community. I propose a policy enactment of the Emergency Overcrowding Act, EOA, that falls under the umbrella of the Emergency Medical Treatment and Active Labor Act, EMTALA. This policy will be federally funded by this act. Each hospital will receive a grant of $750,000 a year if there is compliance with the policy. They will have 3 measurable goals. The measurable goals will be door to triage, door to doctor, and door to admission or disposition. Median times will be set in order to reach these goals. If the goals are not met, the grant money will be deducted by $250,000 each for each of the measures that are not met. In order to assist the emergency department with this goal, we will elicit help from the entire community. Nursing homes will have a median time from the discharge of their residents to have the patient disposition from the unit, whether the patient is an emergency patient or an inpatient. If this goal is not met, then the nursing homes will be fined $500 for each resident. There will be a goal that there will be $1 million granted to each state that agrees to increase the availability of mental health beds in an effort to decompress the emergency department. Once the patient has received a medical screening exam and has been medically cleared, these facilities will have a median time to admit these patients to said facilities. These nurses can then be freed to care for the sick infant that comes through the door, limp, with a mother that is helpless and does not know what to do with her sick child. Nurses, physicians, and families should never be placed in a compromising position where they are so overwhelmed that they do not have the mental capacity or physical capacity to care for these infants or any other patient that comes through the door. Overcrowding in the emergency department is an epic problem that comprises the care and the well-being of each person in the community. Thank you for your time.